The reason for me that I chose it was coming here and seeing that 90% of patients choose the LON, and Dr. Halil has the most experience, it seems, with the LON, and talking to the patients and seeing that they were all very happy, very comfortable with it. It's not the most ideal in terms of sleeping, mobility. You sacrifice some movement, and of course you're going to experience discomfort, but I think it's a small price to pay for what it does. It's a very transparent method and certainly doesn't feel as bad as it looks if you were to just look at it. Overall I'd say I chose it because of the experience of Dr. Halil, but also you can get more height with it. It's also weight bearing compared to the internal method, meaning that from day one I was able to start to train my body to walk without using the walkers. Even though it's very difficult, I could really start doing that and have confidence in standing without any help. That was huge for me. That was actually, I would choose the LON method over the stride or the internal methods mostly because of that. Because from day one I'm able to rehabilitate at least that part of my experience.
Ich habe mich für die LON-Methode entschieden, weil mein Ziel war es, die 10 cm zu erreichen. Und mit der Precice-Methode hast du eben nur die Möglichkeit, 8 cm zu erreichen. Das ist natürlich ein bisschen ungemütlicher, weil du Fremdkörper an den Beinen hast, auch fürs Schlafen, seitliche Lage. Es funktioniert einfach nicht. Aber es sind halt nur 2 Monate, bei mir waren es 7,5 Wochen, die man dann halt durchziehen sollte. Das sind 2 cm mehr und das war halt meine Entscheidung dann für die LON-Methode.
I think that everybody doing the LON method and the way that Dr. Halil do the LON method, it's really better than any place I've heard of, and I think it's easier and it's good. It's easier, and the cost, of course, it's cheaper than other methods. And when I heard about the lengthening, the way we lengthen, it's easier than the Precice, in my opinion.
So there are a couple other methods out there. I know that this clinic doesn't do LATN, lengthen and then nail, and one reason I did not go with a clinic that did that was because the healing process was just too long and it was not weight bearing. There was also internal methods like Precice. However, after speaking with several doctors, including Dr. Holly, if there was something wrong, let's say if there's an infection or something, if I'm doing LON, he can see it right there and he can fix it, he can treat it, as opposed to if it was internal, he would have to open me up in order to see it. So that's why I chose LON, and plus I like that it was weight bearing right from the beginning.
नमस्ते, मैंने LON मेथड इसलिए चूज़ किया क्योंकि मेरा गोल 10 सेंटीमीटर था, जो कि प्रिसाइज से पॉसिबल नहीं है, उससे आप लिमिट से बियॉन्ड नहीं जा सकते. Okay, so I decided to go with the LON method because my goal is like around 9 to 10 centimeters, but I think so with the Precice you can only reach 8 centimeter, but my goal was around 10 centimeters. That's why I chose LON method. And on the other hand, and it's less expensive than the Precice one. It's in my budget. With the LON method you can do your lengthening manually, which is more easy, I think so, as comparison to the Precice. And I think so Precice is all inside, and if you have an infection or anything, with the LON method you have scars and wounds, you can see it easily and you can treat it I think so more easily as comparison to Precice. I think so with the Precice it's hard to see the infection, so that's the main reason to choose LON method. I already reached 8 centimeters now and I'm so happy with that.
Because I knew I could get more centimeters with this method than with the Precice. The Precice is 8 centimeters, and depending on the person's body weight as well. And my body weight was a little bit heavier than normal, so I went with this one, just so I could get the extra 2, maybe 3 centimeters.
I was interested in it because it offered like full weight bearing from the very beginning of once you even in hospital as soon as you wake from surgery, and that it's especially Dr. Halil has special method that he has patented that it's like a very advanced form of LON with special fixator, and for me it just seemed like the best fit. I'm very happy so far that it feels very stable and it's very comfortable, and the lengthening is very simple.
ロンを選んだ理由はまず値段が安いことで、あまり自分は感染症のリスクとか感じてなくて、なる人はいるけどすぐに治るっていうイメージが、あるのと、その痛みとかもなんか別にこのロンの痛みっていうよりは結局伸ばした痛みとかがほとんどなので、あんまりプリサイズは変わらないかなっていうようなイメージがあったからです。
了解です。
First, it is a very robust system, and second reason, it's totally economical. It's cheaper than Precice, but also it allows you to lengthen a bit more than Precice ability. So if you just want to go a bit higher, you would choose LON method. That's the reason.
Because I wanted to maximize my length. I wanted to get like as much as I can.
Yo he elegido el método fijador externo. Bueno, pues pongamos que hay dos factores principales. Primero, el precio. Es más barato el sistema externo que el sistema interno. Pero no solo el precio, sino que además, por la información que yo tenía, que consulté bastante en internet, pues parece que el fijador externo, si hay algún problema técnico o algo, al ser externo, pues para el caso que haya que repararlo o algo, siempre es más fácil que tener que volver a, digamos, que abrir el muslo. Y segunda razón importante es que con el fijador interno solo puedes crecer hasta 8 centímetros, creo. Sin embargo, con el fijador externo, pues puedes aumentar incluso hasta 10 o 11. Entonces, bueno, en caso de que llegues a 8 y no te quedes contento, que no lo sé si será mi caso, pues siempre tienes posibilidad de incrementar 2 o 3 centímetros más con el fijador externo. Con el fijador interno a los 8 centímetros parece ser que no da para más. Entonces, bueno, entre la diferencia en centímetros, el precio y parece que la seguridad y tal, pues yo he elegido el sistema externo. Okay. Y bueno, pues es la decisión que he hecho y de momento creo que es la correcta.
Well, two reasons. One, it is the most common method. Most people use that, and that's for a reason, because it is the most affordable one. So I'm like, okay, that's a win-win. It's more affordable, and also they're more familiar with that kind of surgery. So that's why.
Der Grund, warum ich mich für die LON Methode entschieden habe, ist primär, weil der Heilungsprozess schneller ist. Man ist schneller auf den Beinen, man ist schneller mobil. Beim Precice dauert das viel länger. Und der zweite Grund ist tatsächlich, dass ich mehr als 8 cm erreichen wollte. Das kriegst du dann bei Precice leider nicht hin. Die maximale Kapazität von Precice ist 8 cm. Daher habe ich mich für die LON Methode entschieden.
I chose LON because I wanted to do Precice, but I couldn't do it. The doctor said my bone wall was too thin, I guess. So I had to do LON.
But you reached 10 centimeters. You cannot reach 10 with the Precice.
That's true too. 8 or 10, I was fine. I wanted to do Precice because there's no fixators, you're more comfortable. But he said you can't even do it, so it's okay.
一つは金銭的に安いっていうのが個人的にはあったのと、あとロンの方が体重がかけやすいみたいなんで、ネイルが丈夫でプリサイスより骨形成が早いって聞いたんで、その傷跡が残るデメリットはあるけど、個人的にはロンがいいかなと思いました。
Yes, I think for me it is the best choice. No? So I chose the LON method. From what I understood, you can reach and gain more centimeter with that. So compared to Precice, I think it's 8, and here you can reach 10. It was also for me a cost-based decision, for example. And the third thing is, okay, do you want to have more comfortability, or is it not that important to you? So
after my experience, after I see the other people, I see for me it is fine to have LON method, because if I am in the gym, I don't need Precice. I can really go to the bottom and do and turn around, so I'm flexible, and for me it's not that needed. And even the sleep is also fine for me. So I can also sleep with LON. So I think it's up to the person. Yeah.
The main reason of me choosing LON is my weight. I was having thoughts of going to Precice, but my weight won't allow, and unfortunately my canal was very narrow. It would fit only I think 10.5 millimeter, which wasn't like a good choice because I can't weight bear. And then this is number one, and number two, obviously the budget. I was having issues in the budget. Like I would have done Precice, but it would kill my budget, you know. So.
لأن يعني لون هو جهاز معروف هسه أكثر شيء باستخدامات التيبيا، وأكثر جهاز مضمون للعمليات ما تطويل القامة.
Well, I choose LON Method because of the price, because LON Method is cheaper than Precice, and then I choose LON because I wanna lengthen more 8 centimeters. I wanna lengthen 10 centimeters if my body allows. This is the reason why I choose LON.
Okay, so yes, only there is one disadvantage is you can't take a shower with the LON method. You can take it, but you have to be very careful about the water and everything. But till now my experience is really good, and some days are bad, some days are good, but till 6 centimeters I was going so good. Now it's a little bit, because I already reached 8 centimeters, it's a little bit hard because it's more pressure on the nerves and muscles now, so I just feel more tightness now as comparison to the first. But my experience is really good with the LON method.
You know, the first weeks are challenging, right? The first 2 weeks are challenging, but it does get better day by day. You start to walk better, your legs get stronger, and you can stand and you can walk. So I think I'm 4 weeks post-op, so it's definitely getting better now.
The thing is, just LON methods, it's just heavier on my legs, but I used to it. First days was hard a little bit, but then I used to the weight, and I feel like when normally we exercise, we hold like dumbbells and hold something like has weight. At the same thing, I feel like holding weight all the time, and it's good. I don't think I thought it would be much more harder and it would hurt me because it's an open injury, but it wasn't like that. It's like easier than I expected to be.
Also grundsätzlich kann ich sagen, ich hatte eine gute Erfahrung mit der LON-Methode. Die ist halt nicht so bequem wie die Precice-Methode. Man muss sich das vorstellen, dass man permanent 2 Metallstücke an den Beinen trägt. Das Schlafen ist nicht angenehm. Das ist halt nicht bequem, ist nicht die bequemste Art und Weise, die Verlängerung zu machen. Aber so von den Schmerzen her habe ich da jetzt nichts Großartiges bemerkt. Klar hast du da was an den Beinen drin und mal hast du Muskelschmerzen und mal nicht, aber so an sich, wo ich sagen würde, das waren so unerträgliche Schmerzen bei der LON-Methode, daher würde ich mich nicht nochmal für die LON-Methode entscheiden, könnte ich jetzt nicht von mir behaupten.
デメリットはやっぱ双外固定器がついてるんで、寝る時の姿勢が、うつ伏せになるか仰向けになるかで固定されてるんで、寝返りが打てないのが辛いですね、やっぱり姿勢的に。常にもうピン周りとこの包帯はもう触らないように気をつけてます。あと僕は毎日髪洗ってるんですけど、髪洗う時もタオルかけて、もう水が絶対跳ねないようにしたりとか、もうとりあえず感染症がやっぱり怖いんで、常に注意してますね。でピンの痛みとかは結構怖かったんですけど、全然今んとこ感じなくて、なんで思ったより生活に不快感を感じる ことはないかなっていう。寝るときがちょっとまあめんどくさいかなっていう。そうですね。はい、それぐらいです。了解です。
It's been great. I have almost no complications whatsoever. I can get up from bed in the morning, I can sleep well, and I can dance. I can walk without crutches and stuff. I'm having a good time with this.
What do you think about the scars?
I like the scars, you know? It's memorabilia. I get to keep them forever.
It's been up and down. Some days I'm really good and I don't have any pain, and then other days I have nerve pain. Then just the clicking of the actual fixator just changes my mind. In all, it's been pretty good experience, but it's up and down. It's early mornings, especially when you've been laying for a long time, you get stiff. But as soon as you start moving for a while and you warm up the muscles, and then you get your physio early in the morning, it's great for the rest of the day. If you have your physio in the afternoon, it's a little bit of a headache. Gym sessions, I can't stress enough, you need to do the gym sessions. The bubble ball with your stretching and getting the flexibility is probably one of the best things. It hurts at the start, but once you're finished with that, the day flies. The main problem I do have is sleeping at night. During the day, I sleep a little bit, or actually a lot, 4 hours pretty much during the day. And then at night time, when the bone is and the nerves and the muscles are actually lengthening and growing, that's when it's very hard to sleep. And I do have to take medication.
So far so good. Like it's basically the first 2 weeks I can't say were very tough because your legs are kind of swollen and you can't really feel comfortable when you are mobilizing. You would mobilize, but it's very tough. So doing the easy tasks was a little bit tough for me. But then after that, things getting better day by day. And then every day you would have the muscle stiffness, which is normal, I think. Even if you would have Precice, you would have the same kind of stiffness because it's a muscle stiffness, so you need to stretch more. Of course, obviously it's not really comfortable, but you can live with it, like you can manage it. And the pain is really manageable, it's not too much painful. It's just rather, for example, sleeping would not be perfect because, for example, if you used to sleep on your side, you won't be able to do it now. Other than that, it's doable, you can manage it.
It was pretty comfortable. I used painkillers very rarely. I didn't feel so much pain. It was very smooth. Just after three days following the surgery, I was able to move my legs, my feet, and I was able to walk around comfortably after the first surgery. And after the removal, second surgery, just in a day, there was some parts about feeling pain, but I was able to walk around. So I was able to go to toilet, bathroom. So it was there was no problem.
It was once I got first 2 weeks, I got used to it. I think that the tibias are a little harder than the femur. Femur feels easier because of the Achilles tendon, but I think it just takes a lot of physiotherapy and patience with the process, and I would recommend LON.
تجربة زينة يعني بيها ألم قليل بس عادي يعني تتجاوز كله بالعلاج الفيزيائي.
Nein, würde ich nicht, weil ich eben 2 cm verlieren würde dadurch. Und ein weiterer Nachteil ist, mit der Precice-Methode hast du nicht die volle Belastbarkeit. Und hier konnte ich einfach mehr belasten. Auch während der 4. Woche konnte ich dann halt auch ohne Unterstützung gehen. Und die Recovery-Zeit ist halt auch deutlich schneller und besser, weil du eben unterstützt wirst und die LON-Methode viel stabiler ist.
I'd still choose LON, yeah. Like I said, mostly for the weight bearing. Also, it's more affordable. I suppose that's a big concern. I think everything's going to cost a lot of money. You want to be able to eat whilst you're doing something like this. You want to be able to stay somewhere. Here, of course, it's all included, which is pretty nice. Yeah, I would choose the LON. The only advantage I could see is that I'd be able to take a shower or a bath more easily with the internal, but again, that's a small price to pay for just the few months that I'm doing this. And so far for me, with the bandage changes, there's been no sort of issues, no signs of infection, anything like that. As long as there's a team, I think it's better. Maybe if I was doing this alone at home, I might feel differently, but I feel like I would advise that whatever method anybody chose, that they shouldn't do it at home alone. So for me is a moot point.
No, honestly no. So I'm happy with that right now, and I did already 1 month. It's 1 month to go, and I have no real problem. So I would choose it again.
If I had the budget, honestly, I would still do the LON, even if I did have the budget. Just because it's like, when a surgeon does something more, from my understanding, they're better at it. The majority of patients have LON, so I'm guessing that the surgeon is more experienced with LON. I could be wrong, but that's how I think.
金が無限にあっても自分はロン選ぶかなと思います。お金が仮にあったとしても、もう一個メリットはやっぱ加重かけれるっていうのがあるんで、そういった面でもロンの方が最終的に安全性高いかなと思ってます。
Yeah, if I could, yeah, but I wasn't able to.
Wenn ich genug Zeit hätte, wenn mir 8 cm tatsächlich reichen würden und wenn das Preisliche keinen Faktor spielen sollte, dann würde ich mich tatsächlich für die Precice-Methode entscheiden, weil es ist halt bequemer. Du kannst nach der OP, nach ein paar Wochen kannst du schon duschen, kannst schlafen wie gewohnt, kannst dich auf die Seite legen. Es ist bequemer, ja. Aber wenn es diese Faktoren gibt, wie der Zeitdruck, dass du schnell mobil sein musst und du hast auch keine Narben bei der Precice, zumindest nicht so viele wie beim LON-Methode, dann würde ich mich für die Precice entscheiden. Aber diesen Luxus hatte ich leider nicht, deswegen habe ich mich für die LON-Methode entschieden.
I don't know, maybe yes, maybe not, but it's just not about the price. It's also about, you can lengthen more with the LON method than the Precice. That's another advantage I heard of. And because maybe I will want to lengthen to 10, not 8. And with the Precice, they usually lengthen with 8, not 10. And I think it's, when I saw some patients, I thought that with the LON method, you always have to keep the posture like stable and all these things very well. It forces you to be in a way, to walk in a certain way, but maybe the Precice, because you cannot see it, you just feel it inside. It's difficult to distinguish between how the normal walk should be and how you are actually walking.
I would do Precice, honestly. Yeah. If like I was having no restrictions, I would do Precice. Like it's just mentally, I think it would be better.
ايه عادي، بس هذا الجهاز ما بيه شيء يعني لون، يعني تعودت عليه وصارت عادي يعني متعود، ما بيه أي مشكلة.
Even if the same price, I think I still choosing external. Why? Because I don't know, but maybe with 8 cm, imagine that I see my leg is fit good, and now I want 2 cm more, and what can I do? With this, I have the option. It's important.
So what I will say is you can shower with Precice, right? You can, I think that's my big thing. I can take showers where, you kind of can't keep the fixators. You have to keep them dry. I think that's the big thing with Precice. Other than that, I'm happy with LON.
If I had the chance and I was at the weight limit that they wanted, I probably still wouldn't, because it only would limit me to the certain amount of centimeters that I didn't want. I wanted to have the exact 10 centimeters, and that one you're pretty much at 8 centimeters. And so for myself, I think it's a mental thing as well. I mentally wanted the 10 centimeters to be 6 foot, and with the Precice, even if I did it, I wouldn't have got the goal that I wanted. So that's why I went with this method.
I would choose LON because I would want to go a bit higher than the limits, That's my reason.
If I had the choose and if Precice could permit to gain more 8 centimeters, I will choose Precice.
Bad choice?
Yeah.
I don't see anything bad with it. I honestly don't. I actually like that when they change my bandages, they look right there and say, oh, if something's wrong, they see it and they can catch it really quickly. Lengthening is really easy. You have the little tool and you lengthen and you have weight bearing. So I've never had Precice, but when I read about it, I really did not see an advantage over LON.
Für mich war es die beste Entscheidung. Man muss halt gucken, ist es für jeden halt anders. Es gibt Typen, die wollen eben Precice, weil sie eben diesen Komfort haben möchten. Für mich war es halt wichtiger, die 10 cm zu machen, statt Komfort zu haben. Und deshalb würde ich es halt Leuten empfehlen, die alles rausholen möchten. Also die komplette 10 cm. Aber wenn du jetzt sagst, du machst Femur und Tibia, dann kannst du halt auch Precice machen, meiner Meinung nach. Dass du hier 8 machst, da 6. Also es ist halt immer unterschiedlich, kommt immer drauf an, was für Ziele du hast.
No, not at all. No.
日本の人はロンはやっぱり感染症をすごい恐れてて、それでプリサイス選ぶ人が多いと思ってるけど、まあ実際自分はそんなことないと思ってるんで、特に今の日本人の患者でも感染症になった人とかいないと思うんで、まあちょっと赤くなったけどすぐ治るとかだと思うんで。全然実際は心配することはないかなと思います。
It is hard, like you can't sleep on your side. It's hard to like sit down and things like that. So if you want to be like comfortable during the lengthening, I think you should do Precice, the other one. But if you really like want to do 10 centimeters and comfortability is not that much of an issue, I think you can do LON.
No, I can see from someone's point of view looking at these, thinking that it's so like painful. Does it hurt? Yes. Does it hurt as much as it looks? Not really, no. And I haven't done Precice, so I can't really tell how Precice would feel, but it's really not that bad. As long as you do your stretching like what I was doing just now, you should be able to. You'll be fine.
Das muss, denke ich mal, jeder für sich entscheiden. Von der Verlängerung her, vom Schmerzen her, finde ich nicht, dass es allzu viel schmerzhafter ist als die Precice-Methode. Man muss aber sich hinsetzen und überlegen, okay, was ist mein Ziel, was möchte ich haben und worauf lege ich Wert. Habe ich viel Zeit für die Verlängerung, dass ich nicht schnell mobil sein muss, dann würde ich mich für die Precice-Methode entscheiden. Ist meine körperliche Wirkung, Außenwirkung interessant für mich und ich möchte keine Narben haben, dann würde ich mich auch wiederum für den Precice entscheiden. Oder reicht es mir nur 7 cm zu haben, würde ich mich für den Precice entscheiden. Wenn ich wollte mehr als 8 cm, Narben waren hier nicht allzu viel interessant für mich und ich musste schnell mobil werden, da habe ich mich explizit für die LON-Methode entschieden und bereuen tue ich das jetzt nicht, um ehrlich zu sein.
I think everyone's different. I've only had this procedure, I haven't had the Precice, and the reason why was because I wanted extra length. I didn't want to stop at only 8 centimeters. I wanted to see how far I could go. And the surgery itself, I couldn't feel anything. Waking up, couldn't feel anything. The day after, when the medication wore off, that's when I could start to stiffen up and I was in a lot of pain. But we managed my pain over the couple of days and I had no problem. Being here in the actual center itself changes your perspective. The hospital was a little bit different to what I perceived, but being here with the actual team and having people on hand 24/7 has made my mind at ease a lot. I've got great physio, I've got great a dietitian, I've got great nurses, and everyone is always welcoming and everyone is always happy to help. You just have to text and they're here within 10 to 15 minutes to go with what you need.
他の日本人の方の骨形成とか見させてもらったんですけど、レントゲンとか、プリサイスでも骨形成良かったりする人がいるんで、そこはロンでもプリサイスでもあんまり関係なかったかなっていうのはちょっとありましたね。まあ、そうだから金銭的に余裕があれば、まあプリサイスの方が良かったかもしれないなっていうのは個人的に ありましたね。そう。傷跡もまあ残らないし。まあでも自分は全然ロンにして後悔は全くないんで、今のところ感染性も全くないですし、思ってたよりはまあ快適に過ごせるんで、ロンで良かったかなと思って。
I don't think so. I don't think so. Honestly, like I mean, based on because I mean, like I said, it's like cheap. And then again, it would allow you to wait there. So I don't really say it's bad. But of course, if you have the money to do the internal method, of course, go for internal. It's much more comfortable.
لا بالعكس واحد سويناهم دون.
Bueno, es cierto que en algunos momentos el método externo tienes lo que le llaman los fisios pin pain, o sea, dolor en la incisión, donde están los clavos. Cuando giras fuerte la pierna o cuando haces algún giro o movimiento brusco te duele un poco, cosa que en el otro sistema no ocurre. Pero bueno, no es algo tampoco muy frecuente y es algo que con no hacer movimientos muy bruscos y cuidarse un poquito ya está. Lo que sí es cierto es que el problema principal del fijador externo es el sueño, porque no puedes dormir de lado. Tienes que dormir boca arriba o boca abajo. Y eso sí que es verdad que es fastidioso, sobre todo en el sueño. Pero bueno, yo me he acostumbrado a dormir boca arriba y bueno, al final duermo. Pero luego hay que pensar también en el dinerito que te ahorras, que es un buen dinero también. O sea que bueno, todo tiene su parte y su contraparte.
Absolutely not. My only regret is not doing it sooner. So.
And also you want more than 8 centimeters, right?
Yes.
That's also the other reason.
Yes.
No, not at all. Because I don't have an experience with the Precice, so I can't tell much. But because we have so many patients here with the Precice method as well. So if I compare, I'm really happy with the LON method. So yes, if in future I would like to do tibia, maybe I will try Precice as well, but I don't regret with the LON method because I'm happy and I don't have much problems. Around 6 centimeters I had an infection and it was so easy. They treated it like in just 2 days because they can see it from the outside. They said like it's normal infection. So that's really good point. That's it.
Ich bin keineswegs enttäuscht, weil ich eben mein Ziel erreicht habe. Ich kann jetzt ganz normal laufen. Bin jetzt in der 4. Woche nach dem Removal und kann meine Beine komplett belasten. Konnte ich auch schon in der 1. Woche und deshalb bin ich glücklich darüber und würde es halt wieder mit der LON Methode machen, weil die Recovery-Zeit mir eben sehr wichtig ist, um schnell wieder auf die Beine zu kommen.
Regret? No, I feel very well. Like I have pain sometimes, but I don't regret it because I am achieving my goal, and today it's been like 1 centimeter. It's 1 week, and I feel better. There is no regret, I think so.
Do I regret it? Some days I regret it, other days I don't. I push myself, especially on my low days, especially being away from family and not being able to communicate with them because it's a different time zone. But then I've got a roommate that we can talk about it, and then it just gives me, an extra win, so to speak, that I'll go down to the gym and I will just push out another session. And I just keep looking at that mirror, and every day it gets a little bit higher, so it just keeps me going. So do I regret it? No, not really.
No. For now, no. For now.
Yeah, for me the scars are very minimal, and then I've seen videos of like the laser therapy that Live Life Taller offers, and it's like they're like 80-90% gone afterwards. It's almost like they're not even there, and yeah, it's comfortable. Like I feel like after the first couple weeks, it's like just a part of your body. You just kind of get used to it, you forget about it, and yeah, it's really not so bad.
So do you regret it?
Regret it?
Yeah.
Oh, no regrets, no.
No, I don't regret. No regret. I'm happy with only the sleeping one side. But I knew before coming here, before that LON method, you have to sleep one side. So I have my mind prepared for that. I know that for the beginning.
I'm so happy because the fixators are off. So the day I took it off, I was like, I'm so happy. Yeah.
Not at all. If I would have if I want to do it again, or if like time go back, I will do it again, because it's something that was stuck in my mind and there was no way around it. Like, unless I do the surgery, I won't be able to get rid of the feelings. So I really won't regret doing it. No.
لا بالعكس، مو نادم اصلا. I'm happy. تجربة سهلة الصراحة، يعني بس تحتاج صبر، يعني ما بيها ألم مثل ما تتوقعون اللي حاب يسوي من العرب، بس يبغى صبر. جيب وياك صديقك أهلك وتقدر تسويها. وبالأخص إنه بهذا السنتر ويا دكتور خليل وسيدات والستاف كله معاملتهم حلوة وترتاح، ما تحس نفسك أصلا مكان غريب.
Nein, bereue ich nicht, muss ich ehrlich sagen. Ich habe erreicht, was ich wollte. Ich habe das in kurzer Zeit erreicht. Ich bin auch relativ schnell wieder mobil geworden, den Umständen entsprechend natürlich. Und bereuen tue ich das nicht.
No, LON method is definitely not a bad choice. So, of course, here's important, it depends on patient, because everybody is different. The problem is with the LON method it's not comfortable during the lengthening for 2 or 3 months. It depends on the lengthening period. But the good thing is the LON method, you can walk with full weight bearing. This is the most important thing for this kind of surgeries. So you have your mobility and flexibility. Even you can also walk without crutches or without any support. But of course, we recommend to walk with support during lengthening, because we lengthen the muscle as well. Because of that, you don't have too much stability, and we recommend always to walk with support during lengthening. But the good thing is with the LON method, also when the patient is finished, we remove the fixator, so the patient can also walk with full weight bearing. For example, it doesn't matter with LON method which nail we use. So 10 millimeter, 9 millimeter, 11 millimeter, it depends. But even with that kind of nails, the patient can walk also after the removal of the fixator with full weight bearing. Another important part is the weight. Some patients' weight is 85 kilograms, 90 kilograms, 95. And for this kind of patients, it's Precice really not logic. It can be dangerous because they cannot walk, even with support is hard, but with the LON method they can also walk with full weight bearing. Of course, some patients' goal, like me, is more than 8 centimeter. So with the Precice you can lengthen maximum 8 centimeter, but with the LON method you can lengthen 9 or 10 centimeter. First of all, we have to reach the 8 centimeter, because with some patients, even with the LON method, we cannot reach the 9 or 10, because it depends on the situation. We have to check how's the bone healing, we have to check how's the muscle pain and the nerve pain, and also how is the mobility and flexibility. Precice lengthening and the LON lengthening pain is exactly the same. Just LON method is not comfortable, the one thing, and the second thing is with the LON method you have extra skin pain because of the pin entrance from the proximal and distal part, and this is the reason why you can feel extra skin pain. But the Precice and the LON method pain, I mean the lengthening pain, the nerve, the muscle and everything, it's exactly the same, guys. So why I choose the LON method? Because I did my surgery 3 times with the LON method and not with the Precice, because first of all my bone canal was not suitable even for 10.7 millimeter. This was the first thing for me, important thing, because for this kind of surgeries you have to imagine when we lengthen your bone, so and we lengthen your muscle automatically, so and your muscle will lose the muscle power. And then we here is so important to do the physiotherapy and walk better, of course, if you can walk with weight bearing. Because of that, so your muscle will get stronger and your recovery is also quick. The full weight bearing was another thing for me because full weight bearing for this kind of surgeries is super important also for your recovery. I say always, when you do a good physiotherapy during the treatment and after the lengthening you can walk with full weight bearing, your recovery is really fast. Thing you guys know, I was not the tallest man. I was only 157. For a man, it's really bad situation. And my goal was always more than 8 centimeter. And that was also the reason why I choose the LON method. No, I'm definitely not regretted. So, but of course, when I see our patient, I want to also have the feeling how is the lengthening with the Precice, because I love this game and unfortunately I don't know how's the feeling with the Precice, but I talk to our patient also in the background, very important. I ask them, how are you, how's the pain and everything. For example, we have also patient, they do the LON femur and the Precice tibia, and when I ask them, they say, honestly, the lengthening pain is the same. It's just more comfortable with the Precice, and that's all. But guys, both of our method, I mean the LON method and the Precice method, is really, really good methods. Precice, it's really comfortable. Yeah, you can get shower in during the lengthening. You can wear pants in it during the lengthening. Also, you can sleep on the side. I'm a side sleeper, by the way, and you can do. It's really comfortable. But with the LON method, you have to imagine you have external devices from the outside. You can feel skin pain. Some patients say, I don't have pain, I don't use painkiller. It depends on patient, because we say always, don't forget this please, that what we do, it's not mathematics. You cannot calculate something before and make a plan. So that is biology. So, and here is to know is everybody's different. Yeah. And it depends on patient. I say always, guys, as a patient, the 3-limb lengthening surgery with external devices, the LON method surgery, it's really easy. So we need 2 hours, 30 minutes, it depends on the situation. But your surgeon, so the doctor, they need a big, really a lot of experience for the LON method, because the using with external devices, it's really easy, but one problem can make 1,000 problems, and that's the reason why your doctor need definitely big experience. Another thing is also you need a team. So you need a team. For example, the medical team have to know, okay, our patient need that kind of medication for skin infection. Superficial infection, you need some medication. For another thing, you need some medication. The patient have to be under supervision. So with the LON method, otherwise you can get problems, of course, because it's some external devices. But if you calculate everything, is both our method really good, and also we use our own technique. I mean the own LON technique. Because of the own technique, it's so much comfortable for our patient. Less pain, less pressure pain on the proximal part. I mean that part here, and also. Honestly, maybe 90% of our patients, they don't use much painkiller. Some of them, nothing, because of our own technique. For the lengthening, you need some special techniques. And we have our worldwide own technique, and we have also the patent for our technique. And that's the reason why we are really successful. And also the patient choose us, the Live Life Taller, for the LON method surgery.